All right, I think we'll go ahead and get started. Good afternoon, and thank you for joining the webinar. My name is Sean Rogers, and I will serve as the moderator for today's event. This is the first of a two-part webinar series, the second of which will be held sometime in early to mid-December. We haven't quite nailed down a date yet. Once we get that nailed down, though, we'll make sure that everybody that registered for this webinar receives an invitation for the second part of the webinar series. I'd like to begin by speaking just a little bit about the National Reentry Resource Center. The center, now in its third year, was established by the Second Chance Act to provide education, training, and technical assistance to states, tribes, territories, local governments, service providers, nonprofit organizations, and corrections institutions working on prisoner reentry. The Resource Center provides distance learning opportunities, publications and tools, and a comprehensive website to advance knowledge and training in the field. If you haven't already done so, I would like to encourage you to sign up for our monthly newsletter, which you can do at www.nationalreentryresourcecenter.org. Each newsletter provides the latest research tools, publications, and funding opportunities in the reentry field. After the presentation by our featured speakers, there will be time for a short question and answer session. To ask a question, please type the question into the Q&A panel on the bottom right-hand portion of your screen. We will do our best to get through as many questions as possible at the end of the webinar. If you encounter technical or audio problems during the webinar, please call WebEx Technical Support at 1-866-229-3239. Please understand that there are some technical issues you may not be able to resolve. For this reason, we are recording this event, and we will post it on our website early next week. And once we've got it posted online, I'll be sure and send an email to everybody that registered with a link to the recording. We are very fortunate to have three distinguished panelists with us today. The first is Deena Corso. She is a licensed professional counselor and clinical supervisor for the Multnomah County Department of Community Justice in Portland, Oregon. She's been employed in Multnomah County's Juvenile Services Division for the past 20 years, serving in numerous capacities as both a line staff and a manager. Deena has extensive training and experience with evidence-based practices in juvenile justice. She is trained as both a clinician and a supervisor in 2 evidence-based treatment models for justice-involved youth and their families: multi-systemic therapy, or MST, and multidimensional family therapy, MDFT. She is also certified as a local trainer for the Global Appraisal of Individual Needs, an evidence-based biopsychosocial assessment tool. Deena was instrumental in implementing an evidence-based case management model for probation supervision in Multnomah County. She has trained juvenile probation staff, stakeholders, and community members on evidence-based practices. Deena is a graduate of the American Probation and Parole Association Leadership Institute, and she serves on the APPA board as a Region 15 representative and is also the Juvenile Justice Committee chairperson. Deena received her bachelor's degree in psychology from the University of Illinois and her master's degree in counseling psychology from the University of Oregon. Nathan Lowe is a research associate with the American Probation and Parole Association, where he works on federally funded projects to conduct research and provide training and technical assistance to community corrections field. Prior to working for APPA, he worked in adult and juvenile corrections in Kentucky for numerous years in such roles as assessment specialist, alternatives to detention program coordinator, sex offender counselor, and community intensive supervision officer. Nathan's current research explores the development of a risk assessment tool to identify chronic DWI offenders, the influence of strain on criminal and deviant behavior within a community context, and the impact of earned credit on recidivism among parolees. His most recent work has appeared in the Journal of Community Corrections and Journal of Interpersonal Violence. Nathan is currently working towards a PhD in sociology at the University of Kentucky, and he received his MS in Correctional and Juvenile Justice Studies from Eastern Kentucky University in 2007. Our final presenter is Dr. Geraldine Nagy, and she is the Director of the Travis County Community Supervision and Corrections Department and Pretrial Services, which is based in Austin, Texas. As Director, she has led efforts to work with numerous agencies and local stakeholders to re-engineer the operations of the department to support more effective supervision strategies and to strengthen probation by using an evidence-based practices, or EBP, model. In pretrial services, Dr. Nagy has coordinated a strategic planning process to align services and internal processes towards legal and evidence-based practices. Prior to her appointment, she held the position of Deputy Director for the Community Justice Assistance Division of the Texas Department of Criminal Justice, where she focused on bringing evidence-based practices to community corrections programs statewide. Dr. Nagy is a member of several national advisory boards and work groups regarding evidence-based sentencing and local decision-making, and has worked with the National Center for State Courts to develop training for the judiciary on these topics. Most recently, she has co-authored a 10-step guide to transforming probation departments to reduce recidivism, which is based on her work in Travis County. In August 2010, APPA presented Dr. Nagy with the Walter Dunbar Memorial Award, recognizing her significant contributions in the field of probation and noting her national presence and influence on community corrections. I'd now like to turn the presentation over to Mr. Lowe.
Thank you, Sean. Thank you for that wonderful introductions, not only to myself but my co-panelists today. And I know we're excited to present on this topic today. But first, I want to talk to you a little bit about, particularly to those who are unfamiliar with the American Probation and Parole Association. It's also known as APPA, as Sean has mentioned, and it's an international association composed of members from the United States, Canada, and other countries actively involved with probation, parole, and community-based corrections in both adult and juvenile sectors. All levels of government, including local, state, provincial, legislative, executive, judicial, and federal agencies, are counting among its constituents. Over the years, APPA has grown to become the voice for thousands of probation and parole practitioners, including line staff, supervisors, and administrators. Educators, volunteers, and concerned citizens with an interest in criminal and juvenile justice are also among APPA's members. By continuing to effectively provide services to its constituents, APPA represents a strong, unified voice for the field of community corrections. Please visit, I will ask you to please visit the APPA website, as shown on the top of this slide. You can visit www.appa-net.org. For more information about specialized training, our current projects, and our forthcoming training institute in February 2012 in San Diego, California. We also have an annual training institute next summer in Indianapolis, Indiana, so look out for that as well. APPA is currently conducting a membership drive called Just One, and more information can be found out about the drive by clicking on the link under the announcements section of the homepage as directed on the slide in front of you. Now to the nature of today's training session. The goal of today's training is to educate you, the participants, on the current trends of evidence-based practices, or more commonly known as EBP, of probation supervision in both adult and juvenile sectors. As you will read, this training has 4 overall learning objectives. The first one is to gain a general understanding of the core elements of EBP and probation supervision. I will discuss these elements during the first part of the webinar. However, Dr. Nagy and Ms. Corso will discuss them as well. The second goal is for participants to be able to discuss the pros and cons of EBP implementation. Dr. Nagy and Ms. Corso will discuss the various ways in which EBP implementation has impacted outcomes such as recidivism and the major challenges of EBP implementation they have experienced in their respective jurisdictions. Third, participants will be able to recognize key leadership abilities and characteristics that have proven to be conducive to using a successful evidence-based approach. These leadership qualities will be drawn from the literature on EBP and correctional settings, and again, from the practical experiences of my co-panelists. Lastly, we hope that participants are able to identify at least 2 practices, if not more, that they could implement to enhance probation supervision in their own jurisdictions. So, let's begin with a working definition of evidence-based practices, or EBPs, as they specifically relate to community corrections. The Crime and Justice Institute, or CJI, which has worked with the National Institute of Corrections on implementing effective correctional management of offenders in the community since 2002, defines the EBP as the, quote, objective, balanced, and responsible use of current research and the best available data to guide policy and practice decisions such that outcomes for consumers are improved, end quote. In the case of community corrections, consumers include offenders, victims, and survivors, communities, and of course other key stakeholders. In adding to this definition, Mark Carey of the Carey Group suggests such decisions should be selected and applied to ensure fair, just, proportionate, and effective sanctioning goals. So what's the point of EBPs? Why is it important for the community corrections field to embrace and implement EBP in their jurisdictions? Well, in answering this underlying question or these questions, let's think back to our consumers. For offenders, research has found EBPs to reduce recidivism, regardless of whether we are referring to new arrests, technical violations, or reincarceration in prison within a specific period of time, for example, 2 years. For victims and survivors, by reducing recidivism, EBPs can dually reduce victimization and thus prevent future acts and harm doing to individuals. This is also applicable to neighborhoods and communities in regard to upholding public safety. EBPs can reduce costs that are primarily associated with mass incarceration of offenders, which can then lead to government jurisdictions developing fiscally responsible practices and policies. And by the very nature of implementing EBP at any agency level, collaborations will form between justice and non-justice agencies in order to increase overall effectiveness. In the end, the evidence-based approach leads to a core quality assurance and evaluation process that involves critically reviewing research literature on the latest EBP trends, ensuring that EBPs are replicated with fidelity, which my co-panelists will speak more about, and evaluating new practices or programs to determine their effectiveness. As mentioned, the Crime and Justice Institute has worked closely with NIC over the last several years, where they have compiled a coherent framework of 8 guiding principles of effective intervention. I will quickly review those before I hand it off to my co-panelists. These principles have been developed based on a wide range of research findings and recommendations. I would like to simply introduce each of them right now. The first principle is the practice of conducting ongoing assessments to determine the actuarial risk and needs of justice-involved individuals, in this case, probationers. Conducting the assessment process correctly can lead to effective case management of probationers, including supervision and identified treatment. The second principle is to enhance the intrinsic motivation of probationers to change their non-conforming behaviors and attitudes to develop a more pro-social lifestyle. Third, this principle requires a little bit more detail. It deals with appropriately targeting interventions to probationers. This principle encompasses a number of factors, including risk, or matching the level of program intensity to the risk level of the probationer, where treatment and supervision resources are reserved for probationers with the highest risk to recidivate. The need principle, which is targeting interventions to the criminogenic needs of the individuals. The responsivity principle, which is simply matching the style and mode of intervention to the probationer's learning style, abilities, temperament, motivation, gender, and culture, among other factors. Dosage, which means to structure the appropriate amount of time with a treatment level. And finally, treatment, which is to integrate treatment, particularly cognitive behavioral types, into the full sentencing and supervision process. The fourth principle deals with providing evidence-based programming to justice-involved individuals that emphasizes cognitive behavioral strategies and is delivered by well-trained employees. This may include such training as motivational interviewing or stages of change, both of which I'm sure many of you are familiar with. The fifth principle emphasizes the need to increase the positive reinforcement among individuals to promote sustainable behavioral change. In practice, there should actually be a fine balance between holding individuals accountable and providing them with incentives for their behavior. Sixth, and this may be one of the most difficult tasks, realign and actively engage pro-social supports for probationers in their natural communities. Research indicates that many successful interventions with extreme populations, such as inner-city substance abusers, the homeless, or even those who are dually diagnosed, which we commonly find in the community corrections field, actively recruit and use family members, spouses, and support of others in the individual's immediate environment to positively reinforce desired new behaviors. And the final two principles specifically pertain to the organizational process of the agency. Measuring the interventions and services to determine ideal outcomes is obviously very essential to evidence-based practices. This includes conducting quality assurance on employees as well. Then, once a method for measuring relevant processes and practices is in place, the information must be used to monitor process and change. This helps to build accountability and maintain integrity into the organization's mission. Now that we have a general understanding of evidence-based practices, or EBP, of community supervision, particularly with respect to probation supervision, we will now transition to specific discussions on these practices as they relate to both adult and juvenile probation. We will first begin with a focus on EBPs of adult probation, which Dr. Nagy will present. In her discussion, she will address the following underlying points and questions. One, describe the evidence-based practices that her agency currently employs based on these guiding principles in which we just spoke of. Secondly, what impact has the implementation of these EBPs had on outcomes, such as recidivism? Third, what have been the major challenges of implementing EBPs in her jurisdiction? Fourth, in her view, what are the essential elements to promote effective implementation of EBPs? And finally, we're going to ask her to describe the leadership styles or characteristics that she perceives as most conducive to using a successful evidence-based approach. Please welcome Dr. Nagy.
Hello, I'm Geraldine Nagy, and I want to begin by thanking the National Reentry Resource Center and APPA for the opportunity to participate in this webinar today as a panelist. As Nathan mentioned, there are 8 guiding principles of EBP, and he also indicated that I would talk about how we integrated those principles into our operations at Travis County, highlighting a few specific areas that we felt were key in this process. I want to, however, talk about this slide first because I think it's critical to have a long-range plan on how you implement EBP within the probation setting. I think it also nicely illustrates how these principles interact and fit together, and also show that the implementation of evidence-based practices really involves 2 parallel processes. If you look in the middle of the chart, you will see things such as our diagnostic or pre-sentence report. You will look to see, you'll see things such as differential supervision, whether or not our programs and interventions work, and whether or not we're able to use a progressive sanctions model for violations. All of the things within the middle of this chart relate to what we do within the context of probation. However, if you look external to that center area at the brown-colored arrows that really confine it or circle around it, these are areas that relate to how we do business. So if you look at the bottom brown arrow, it's important to recognize that not only must we change what we do, but we must also provide our own staff training and development in those particular areas, but measure those areas for our staff to give them feedback as to whether or not they're effective in adapting the new model. At the same time, if you look at the top arrow, you'll see that it's important to also look external to the department and work with our community stakeholders and also develop a relationship with our community providers and the community itself. And then finally, of course, the outer arrows on each side refer to measurement and providing those numbers to those that are interested in our effectiveness. This chart, I think, also is key because it indicates the importance of having both a short-range and a long-range plan. Anyone deciding to implement evidence-based practices, I think it's important for them to recognize that EBP cannot be achieved quickly through changing one element or one practice or focusing on one of the 8 principles. Rather, it's a systemic change, both in the way we do business and then what we do. And in my experience, that has been a never-ending journey. So let's talk then about Travis County's long-range plan. We began our evidence-based initiative in 2005, and we began it by doing an organizational assessment looking at our operations along the 8 guiding principles that Nathan just provided to you. We created a planning structure. We trained officers on what this meant to get to really define our vision. And then we started putting together a planning process in order to develop a strategic plan. That strategic plan is in front of you in this next chart, or this next slide. Travis County divided our strategic plan into 4 phases. During Phase 1 and Phase 2, which were during the years of 2006 and 2007, most of our efforts were on planning and implementation of the specific tasks that we had to do to bring our own operations into compliance with EBP. So we focused on the diagnostic process. We focused on supervision strategies. We focused on our sanctioning strategies. We began to look at our caseloads and also our internal programs. We began to create some structure for quality control and some planning in that area so that once these things were accomplished, we could determine whether or not they were done with Fidelity. We did training, and then we modified our personnel evaluation. In Phase 3, which took place, Phase 3, which took place in 2008 and 2009, we focused on receiving feedback from our own staff, but also our stakeholders to fine-tune key areas, such as the diagnostic report, supervision strategies, and our sanctioning strategies. We worked in a more focused way towards interfacing better with our broader criminal justice system. If I were to do this again, I would put that back in Phase 1 and Phase 2, because I think that's an important part of your planning process. And then we began to measure our first set of outcomes. In Phase 4, which we are in now and which began in 2010, this really refers to ongoing activities which sustain your evidence-based practices. So we began to measure Fidelity. We focused more on data-driven policy development. And our goal is really to create a learning organization culture that supports evidence-based practices in the long term. So now I'm going to turn to some specific examples of things we did. One of the things that was key for Travis County, which may not be key for all departments, was our pre-sentence investigation, or what we now call our diagnostic report. And before April of 2007, our PSI was simply a story. It was a biography, and it was affected by different writing styles, and it was not assessment-driven. In April 2nd, 2007, we implemented our diagnostic report, which was assessment-driven, was based on actuarial assessments of risk, criminogenic needs, and also looking at substance abuse and mental health screens. And then we created a different kind of PSI, which more clearly identified these factors. So we moved from a narrative-type format to one which was focused less on writing and more on information gathering and the presentation of that information to our courts and our other stakeholders in a user-friendly way. This next slide shows a matrix of one area that was changed within the diagnostic report. Clearly, evidence-based practices, we all know this now, requires us to identify those factors that, if we could change, would impact the person's probability of reoffending again. So as part of our PSI, we put in a matrix like the one that you see here, although this is just some of the elements that we look at. But it shows a domain, which is actually criminogenic needs. We're just looking for a different word than criminogenic need. That tends to not be intuitive to a lot of folks. And then we identify whether or not this is an issue, a potential concern, or a salient concern for this particular offender. And that is where it's shaded. And then within the shaded area, you see bullets, which further explains or elaborates on that particular problem area. So this is something that our courts have available to them, along with the risk score, a substance abuse assessment, and recommendations to the court regarding particular interventions that might be effective to address these particular criminogenic areas. The reason why this was so important for us was we were finding that our conditions of probation did not match the recommendations that we had previously given to the courts in our PSI. And now that we've implemented this process, we find that those recommendations and the actual conditions agree 90% of the time. Another area that we focus on is supervision strategies. Travis County actually always had an assessment. It was done by the officer, but what we found in our organizational assessment is that it was very rarely used. So now that we had it in the diagnostic report, it was no longer necessary for the officers to do this, which freed their time from their very first meeting to work with the offender to design a case plan that would address those specific criminogenic needs. What we had found in our organizational assessment as well is that low, medium, high-risk folks, regardless of need, were all seen the same and pretty much supervised the same. So we made major changes using a committee of officers and other folks to change the supervision strategies and our case management system, including our documentation protocol, to be driven by the assessment and the criminogenic needs that were identified within the diagnostic report. In addition, and so I'm focusing mostly on the 3 red arrows on this slide. We did other things as well, but I'm going to focus in this presentation in that area. And we also began a pretty aggressive training effort to get our staff, our officers, familiar with and then using motivational interviewing, because we felt that it was necessary for them to know how to use this to engage people in the particular plan that they had developed with the offender. And that plan is developed with the offender via a negotiation. Okay, I'm going to move on to a third example of evidence-based practices, and now I'm moving from that inner area to the outer area, which is our business practice. And so one of the guiding principles is that we be able to measure fidelity and the impact of any initiative we have, whether or not it's changing our probation processes and practices or if it's a new program. And one of the key things for me is to be able to look at these things together, to be able to evaluate what's happening within the department. So if you look at this chart, you can see that if you have great outcomes, but you have poor fidelity, you are simply just lucky. Something happened to increase your outcomes, but it is not your program because it's not. People aren't following what you design. On the other hand, if you have high fidelity and low outcomes, you simply have an ineffective program or ineffective EBP model. The goal here is to be high on both outcomes and fidelity, and then you know you have an effective program. So I'm going to talk a bit about our measures of outcome for the changes that we made for probation in general with EBP. And this slide that you're looking at now is this slide. It's some research done by Dr. Tony Fabello, as he was working with us on our EBP initiative. And this slide looks at our outcomes 1 year after placement and supervision, and it looks at different groups of folks. And I'm going to focus on those people where it says pre-TCIS. TCIS is our EBP initiative. We call it Travis Community Impact Supervision. So we looked at those folks that were placed on supervision before we made the changes. And as you can see, for low-risk folks, 26% were rearrested, and this is statewide DPS, Department of Public Safety, arrest records. And the medium, 26%, and high, 34%. If you look over at the blue, we also have a transition group, but look over at the first blue column. That is a post-TCI group, TCIS group. So these are folks that were placed on probation from July to August after we made our initial changes. And this is 1 year after placement. The rearrest rate for the low group was 6%. For the medium group, it's 13%, and the high group, it's 31%. If you look at the circle, that is the percent change in rate from pre-TCIS to post-TCIS. So it was a 77% reduction for low, a 50% reduction for medium, and a 9% reduction for high, with an overall 17% reduction. There may be other explanations for the reduction for low risk, maybe having to do with assessment and so forth, but we believe that a substantial amount of that reduction is due to the fact that we way over-supervised and programmed low-risk folks. But overall, there's a 17% reduction in recidivism as a result of our implementation of EBP. This next slide shows a reduction in our revocations. The top blue line under revocations shows a 3% reduction in our just overall all of our revocations from 2005, which was when we started to implement EBP, to 2010, and it's a 51% reduction in technical revocation. And we also found a reduction in our absconders, and if you calculate the percentage, that's a 47% reduction in individuals absconding from supervision. I'm going to quickly go through our Fidelity measures. What we did is we said, during various points where a person is on probation, they receive various services or interventions or responses. And what we need to do is look at each of those points, which are shown on this chart, and decide what could we measure at this particular point to determine if, in fact, we're doing things as we had planned to do them. For example, with the diagnostic report, we would look at risk to see that all officers that do a risk assessment are essentially agreeing on the risk score, and the same for other assessments and the identification of the criminogenic needs. And so what we did is we did that for each of those points, and then we created a protocol using various forms in which we looked at either the paper files or a case management system, and we came up with measures for fidelity at each of those points. I'm going to focus on just one area, which is the supervision agreement. So under ongoing supervision, one of the elements we looked at, was there a supervision agreement in the file? And in 2009, in 85% of the cases, there was. In those particular cases, if there was a supervision agreement in the file, we looked at factors such as, was it signed by the probationer? Was it negotiated? Were criminogenic needs identified? Were those criminogenic needs the same as the diagnostic report? Was the supervision agreement the foundation of the office visits? Did it drive the conversation? Were criminogenic needs discussed, and did the probationer make progress? And you see those percentages there. That allows us to decide, are there areas that we need to retrain, focus on, or coach? So, for example, was it negotiated? You could see that we have areas of improvement there, and were the domains the same as the diagnostic report? That raised some eyebrows for us. But what we found is in supervision, people need the flexibility to identify additional criminogenic needs. Another question we had, so we know that the supervision agreement, there were differences in quality. Were there differences in outcomes for those individuals who had an officer that complied with the EBP supervision plan and those that did not? And this is based on just a few small numbers. It's not, you can't really draw solid conclusions from this. But the data is promising. It shows that those who had a quality supervision plan were less likely to have a new offense, both felony arrest and misdemeanor arrest. They were, however, less likely to get, more likely to get revoked, which may indicate that those individuals that did not do a quality supervision plan maybe also were lax in, this is one possible explanation, lax in their supervision of the case and violations. Some common challenges, I put what I think are the key ones up here. I think there can be a misunderstanding of the term EBP. We already talked about that. The second one I think is key. The infrastructure is not in place. When we talk about evidence-based practices in the long run, we're really talking about an organization that uses data and evidence to make policy decisions and to tweak the system as they go along. And oftentimes those correctional data systems are not in place, they're incomplete, or they're not designed to get the appropriate relevant measures. And then oftentimes there's also a lack of expertise at the local level to conduct or interpret that research so it really can be, can feed into policy. Funding and resources, I think we could all agree on that one. The next one I think is key as well. Departments often attempt to implement components of EBP without attention to culture. And so while I'm talking about this today, one of the things that could be a whole new seminar in itself is how do you get your culture, transform your culture so that you not only don't have resistance to EBP, but once you're at a certain point, you know that EBP is institutionalized and it's there to stay. And I think that's a major challenge. And then finally, in some cases, it's difficult to get the involvement of the judiciary and other criminal justice stakeholders. That was not the case in Travis County, but I think that it is often the case. My final slide, or next to the final slide, I'm just going to say a few words about leadership. I think the key to implementing evidence-based practices are mid-managers. So I think it's key for those individuals to play a leadership role. So it's important to engage staff, and as I said before, it's important to engage the stakeholders. Already talked a bit about assessing your organization's readiness for change and addressing those organizational issues. I think a big one is to strike a balance between big picture and detail. Most change initiatives don't work out. They don't happen. And generally it isn't due to a lack of ideas. It is actually due to a lack of attention to implementation and looking at implementation from a strategic and systemic point of view. And I think that's a difficult thing to do. I think it takes real leadership skill, and I think it's an area that I definitely need to develop in which we specifically work to develop that in our mid-managers and administrative staff. I think decision-making skills are key. I always have the temptation to respond to an opinion or someone telling me it's a certain way, and it always takes discipline to say, okay, I need the data to do that, and I need to talk to folks that are really involved at the operational level to make sense about this data and make a decision that way. And so that leads to effective utilization of data. And finally, for me, this was key, pay attention to the pace of change, because I think I'm a person that likes to get things done quickly. Most of us directors probably are, and it was real important for me to really think about how do you communicate, what's the right time to communicate, and then finally be aware of wearing out staff. That was important. If you'd like more information about evidence-based practices in Trask County, you can get the 10-step guide at the Justice Center, so I've provided that link there. And I think that's it. Nathan?
Thank you, Dr. Nagy. And I also like to say at this time, I know some folks have already posed a number of questions regarding some of the content in which Dr. Nagy discussed. So my email address as well as Sean's email address will be provided on one of the slides towards the end of the training session today. So if you have any questions whatsoever regarding the content of this training session or more specific questions about the implementation process in both either Travis County or Multnomah County, please don't hesitate to contact me. Now let's switch gears to a discussion of how EBPs are situated within juvenile probation. Like Dr. Nagy, Ms. Corso will address the underlying points and questions as seen on this slide. So let's give our attention to Ms. Deena Corso in her discussion.
Thank you, Nathan, and thank you, Dr. Nagy, for your informative presentation. It's my pleasure to talk with you all today about Multnomah County's experience with evidence-based practices over the past 15 years and what we have learned through our implementation efforts. In addition to sharing with you what models and practices we employ, I'll talk with you about the effects that they've had on our outcomes, some of the challenges we faced, elements that jurisdictions need to consider for a successful EBP implementation, and characteristics of leaders that are beneficial when adopting evidence-based practices. To begin, I think it's important or helpful to provide a little overview of Multnomah County so you have a sense of the population that we're serving. Multnomah County is comprised of the city of Portland as well as several smaller surrounding municipalities. We're the most populous county in the state of Oregon with approximately 750,000 residents. According to the 2010 U.S. Census Bureau report, we have a predominantly white community with some diversity, as you can see on the slide. And we have a healthy juvenile population with about a fifth of our residents being under the age of 18. Like most jurisdictions around the nation, we have struggled economically over the past decade with many of our residents continuing to experience unemployment and poverty. Our Juvenile Services Division is part of our Department of Community Justice, which has responsibility for probation and parole supervision for adults as well as probation supervision for juveniles. In Oregon, juvenile parole supervision is provided by the Oregon Youth Authority, which is a state agency. Within juvenile, we have 3 sections. All of the sections have implemented evidence-based practices, which I will share with you shortly. For context, however, it's useful to understand that our Counseling and Court Services section processes all of our law violation referrals, including making decisions to handle cases informally or take them through the adjudication process. And that section provides probation supervision services. Our Custody Services section runs our county's detention facility and also oversees detention alternatives and our accountability programs. Our Treatment Services section provides in-house cognitive behavioral skill building as well as an outpatient mental health and addictions treatment program and a secured residential alcohol and drug treatment program. I'll start by describing the evidence-based practices that are currently employed in our Counseling and Court Services section. From the time a referral is made to our department, decisions about which cases come into the system are based on objective criteria. Whether a case is handled formally or informally depends on risk level as opposed to the presenting offense. Through agreements with our stakeholders, including the District Attorney's Office and the Judiciary, we're able to assess use based on risk and then decide whether or not to proceed with informal handling, which could include a warning letter, a sole sanction, or a period of informal supervision, or to proceed with adjudication. Our department uses a validated instrument, which we refer to as the JCP, to assess actuarial risk and need. The JCP determines a risk level of low, medium, or high, and also assesses criminogenic needs in 6 domains: Those domains include attitudes, values, and beliefs, peers, behavior, family, school, and substance abuse. The JCP stands for Juvenile Crime Prevention and is a tool that is used statewide by the counties as well as the Oregon Youth Authority in assessing risk and need. The tool also assesses protective factors and some responsivity issues such as mental health. In addition to using risk level to make case processing decisions, we also use risk levels to make sanctioning decisions. Lower risk youth are ineligible for certain sanctions. Attention is paid not to mix lower risk with higher risk youth in skill groups and accountability. Similarly, services are targeted to the highest risk probationers with lower risk youth receiving services in the community rather than through the juvenile justice system. The dosage and treatment principles guide the probation officer's decision-making about what referrals are made and what services are offered. Functional Family Probation Services, or FFPS, is a case management model based on the heavily researched principles of functional family therapy. It uses 3 phases to guide the work of the probation officer. The first phase is engagement and motivation and is focused on enhancing intrinsic motivation, one of the principles of effective intervention that Nathan touched on earlier. The second phase of FFPS is support and monitor. In this phase, probation officers are making referrals to appropriate treatment and skill-building services and monitoring youth for participation. Probation officers utilize positive reinforcement to support probationers in successfully completing services as well as their accountability requirements. The third phase of FFPS is generalization. During this phase, the focus is on engaging ongoing supports in the youth's natural community, another principle of effective intervention that Nathan previously described. The FFPS model requires participation by the parents or caregivers, and services are primarily delivered in the home. This model originated in Washington State a little over a decade ago, and we implemented it here in Multnomah County in February of this year. Since we've only been using FFPS for about 8 months, our probation officers are still in the process of becoming proficient in the model, and we do not yet have any outcome data. But research on the model's effectiveness in other jurisdictions shows favorable outcomes in terms of both reduction of recidivism as well as significantly less reliance on the use of expensive out-of-home placements like foster care, residential facilities, and close custody. Evidence-based practices are also alive and well in our custody services section. Here we use an objective and validated instrument called the RAE, which stands for Risk Assessment Instrument, that is used to make decisions about who is admitted to detention and who is not. Only youth who are deemed to be a significant risk to public safety or who pose a flight risk are typically detained. Detention alternatives are used whenever possible in lieu of confining youth. Again, only those youth that pose a serious risk to public safety or those who are unlikely to appear for their next court appearance are held in custody pre-adjudication. Youth who do not fit this criteria are released back to the community awaiting adjudication. Enhanced supervision, such as electronic monitoring or GPS, may be used, and youth may also be placed in a temporary shelter if they cannot be safely maintained in their home, but also do not meet the criteria for being detained. Of course, some youth do end up being held in custody, either pre-adjudication or as a sanction post-adjudication. While in custody, youth participate in evidence-based skill-building groups. One EBP that is provided is skill streaming, which employs a 4-part training approach: modeling, role-playing, performance feedback, and generalization, to teach essential pro-social skills to adolescents. Another evidence-based curriculum that is provided in our detention facility is Thinking for a Change. This is an integrated cognitive behavior change program for offenders that includes cognitive restructuring, social skills development, and development of problem-solving skills. The last section in our Juvenile Services Division is Treatment Services, which also utilizes a range of evidence-based practices and programs. Some of you may be familiar with these interventions, which will take just a moment to describe. The National Curriculum and Training Institute, or NCTI, develops cognitive-based life skills and offense-specific curriculum for practitioners in the field of community corrections. These cognitive-based curricula clearly align with the What Works research and have proven to be effective in reducing recidivism. In Multnomah County, these groups are provided for high-risk youth and match their identified criminogenic needs. The Global Appraisal of Individual Needs, or the GAIN, is an evidence-based biopsychosocial assessment tool created by Chestnut Health Systems in Bloomington, Illinois. It's been heavily researched and is recognized for its strong reliability and validity. We've been using the GAIN for the past 8 years in Multnomah County to assess mental health and addiction issues and to make treatment recommendations. Multidimensional Family Therapy, or MDFT, is a comprehensive and multisystemic family-based outpatient program for substance-abusing adolescents, adolescents with co-occurring substance use and mental health disorders, and those at risk for continued substance use and other problem behaviors such as conduct disorder and delinquency. Working with the individual youth and his or her family, MDFT helps the youth develop more effective coping and problem-solving skills for better decision-making and helps the family improve interpersonal functioning as a protective factor against substance abuse and related problems. Motivational interviewing is well known in the community supervision world and is a goal-directed, client-centered counseling style for eliciting behavioral change by helping clients to explore and resolve ambivalence. The operational assumption in MI is that ambivalent attitudes or lack of resolve is the primary obstacle to behavioral change, so that the examination and resolution of ambivalence becomes its key goal. Stages of Change model conceptualizes 5 stages of change for a variety of problem behaviors. 5 stages of change are pre-contemplation, contemplation, preparation, action, and maintenance. Again, this is a model that you are probably very familiar with as it's been widely utilized throughout community corrections and juvenile justice, so I assume that's not news. The True Thoughts corrective thinking process is founded upon the understanding that an individual develops behavior patterns, both positive and negative, to explain, support, and validate the individual's worldview. This curriculum applies those principles to effectively modify behavior and change offenders' thinking. So with so many evidence-based practices being implemented in all of our different sections in our agency, it's impossible to pinpoint exactly which program or practice is responsible for what outcomes. However, we have experienced many positive trends which are likely the result of youth receiving a combination of the services I've described to you. To begin, we've significantly reduced our juvenile probation population over the past decade from over 1,000 to approximately 350 youth currently on probation. This has not happened by chance. Rather, it has required a deliberate and collaborative effort to divert lower-risk youth away from the juvenile justice system and to only adjudicate those youth who are most likely to commit crimes in the future. Similarly, we've greatly reduced the number of youth who are confined to our detention facility. Through the use of objective instruments to make gatekeeping decisions about who gets into detention, as well as the development of alternatives to detention, we've been able to keep the number of youth who are detained to a minimum. To give you an idea of how small our custody population is, on any given day, the number of youth being held either pre-adjudication or as a sanction is typically less than 20, with 5 or less of them being detained as a sanction for a law violation or probation violation. In addition, we have ensured that limited resources are targeted to the highest risk youth. Low-risk youth are generally warned or given a sole sanction, and the youth who receive supervision and services are those who are most likely to recidivate without intervention. Like many jurisdictions across the nation, Multnomah County has seen juvenile crime steadily decline over the past decade. While Multnomah County is not unique in this reduction, it's noteworthy that this phenomenon has happened despite the fact that we are not formally adjudicating nearly as many youth, and we're not relying heavily on detention as a sanction. Another impact is that our recidivism rates have remained steady despite the fact that we are only serving medium-risk and high-risk youth, again, those most likely to recidivate without intervention. At first glance, it may not seem like a success for recidivism rates to stay the same, but if you consider that we are no longer supervising youth who were unlikely to recidivate in the first place, so we no longer have those youth included in our statistics to lower our recidivism rates, it really is significant that our recidivism rates have not increased. The use of evidence-based practices has increased consistency and equity within Multnomah County's juvenile justice system. Objective instruments are used at critical decision points to ensure youth are treated fairly and that least restrictive alternatives are utilized. Risk and need are assessed to make sure that the principles of effective implementation are applied appropriately and that youth and families are connected to interventions that are most likely to positively impact their criminogenic needs. Another benefit of using evidence-based practices is that probation officers now have a better understanding of what to do and how to do it when they are meeting with youth and their parents. For years, we have had guidelines about how often a probation officer needed to meet with a youth on their caseload, for example, weekly for high risk, every other week for medium risk, but we failed to pay attention to what the probation officer did with the youth during these meetings. We also had no standard about engaging parents or caregivers. Some probation officers did it, others just met with the youth. Now we have expectations that probation supervision not only includes parents, but that it is also family-focused and strengths-based. Additionally, the FSPS model requires probation officers to be alliance-based rather than fear-based. This means that probation officers must build a relationship or rapport with the youth they supervise, really get to know them and understand how they see their world, rather than telling kids, if you don't do X, then something bad is going to happen to you. Perhaps the biggest impact of implementing evidence-based practices in our agency, however, has been the increased emphasis on quality assurance. We measure not only outcomes for youth and the community, but also how well we are doing with adherence and fidelity of the different models that we employ. This focus on quality assurance has raised the bar for all staff. Implementing evidence-based practices in your agency is a worthwhile thing to do, but it doesn't happen without challenges. To begin, it's a lot of work to change practices and ultimately to change a culture. It requires tremendous effort and a willingness to study current practices, research better ways of doing business, evaluate the impact of changes, and collaborate with system partners. This does not happen quickly. It is essential that the leaders of an organization be fully committed to implementing evidence-based practices before beginning down this path. Any indication that there is ambivalence within the leadership will be a sure sign to staff that these changes are just the flavor of the month and that they can simply wait it out until the next new thing comes along. Staff also need to know why the leadership is invested in changing practices. They need to be educated about best practices, and they need to know what outcomes are expected as a result of the change. If they understand the rationale for implementing EBP, and if they have a role in developing new practices, they will feel more ownership and there will be less resistance. Another challenge is that it can be expensive to adequately train staff and stakeholders. Implementation of evidence-based practices does not happen by sending everyone to a one-day training. It takes practice over time with lots of feedback from supervisors and perhaps even consultants to really attain a high level of competence with these new skills. The research is clear that using EBPs is cost-effective. When we do the right thing, we reduce costs associated with future crime, out-of-home placements, and incarceration. But there are definitely upfront costs required in implementing EBPs in your agency. Another challenge is freeing line supervisors up from other responsibilities so they can truly become experts and adopt the role of coach with their staff. Too often, line supervisors are spread way too thin, asked to attend meeting after meeting, expected to attend to all sorts of administrative tasks, and they have very little time left to observe their staff's work and provide meaningful feedback and guidance. It is absolutely critical that line supervisors be able to focus on this important role, and typically it involves a reprioritization of their work in order to effectively implement EBP. As I've previously mentioned, another critical aspect of implementation is the involvement of key partners and stakeholders. This isn't always easy, particularly when there are competing interests at play. However, just like with your staff, involving key stakeholders in understanding the rationale and also developing the new practices will increase their buy-in and decrease resistance to the new practices. The focus on fidelity and adherence can also be a challenge. Staff may feel that their own way of doing their job has been working to them just fine and often feel stifled when they are required to do their job differently or according to a particular model or practice. It can feel uncomfortable and be frustrating. Related to this is the need within the organization to have capacity for capturing and analyzing data in order to measure relevant processes and practices and provide measurement feedback. The following essential elements come from the Crime and Justice Institute and were specifically designed to promote effective EBP implementation. First, leaders must present a powerful business case throughout the agency for the use of EBP, ensuring all staff understand the principles behind EBP and how it will lead to improved outcomes. The mission, vision, and values must reflect a commitment to EBP. Implementation requires an inclusive process that elicits agency-wide and stakeholder participation. Leaders must have the skills necessary to implement EBP. Budget priorities should align with EBP, and policies and procedures need to reflect the principles of EBP. A plan for communicating information regarding the EBP implementation must be developed, including staff as well as external organizations and stakeholders. All agency staff need to be trained in the philosophy, principles, and implementation of EBP. Managers and supervisors should be trained in leadership and change management. Supervisors require skills to conduct ongoing performance monitoring and case audits. Teams consisting of both management and staff must have clear direction for what is to be accomplished and should be able to define successful EBP implementation. Teams need to have established timelines and methods for measuring progress. System stakeholders and service providers must be involved in the planning and implementation process. Contractual agreements need to reflect the principles of EBP. Organizations must have a system for monitoring and providing feedback to service providers and contractors. And finally, job descriptions, hiring practices, and performance appraisals all need to reflect the agency's commitment to EBP. Staff performance must be regularly monitored and consistent feedback must be provided. Staff should be promoted based on their knowledge, skills, ability, and attitudes related to EBP. So there's not just one right leadership style that's most conducive to a successful implementation of evidence-based practices. Rather, there are characteristics of many known leadership styles that can be drawn upon in this endeavor. From my experience, the most successful leaders are those that are eclectic. In other words, they use the best parts of many styles, recognizing that every style can have its own limits and problems. I will talk with you briefly about several different leadership styles and the positive aspects of each that can facilitate the process of implementing evidence-based practices in your agency. I'll start with transformational leadership. Transformational leadership begins with the development of a vision and a view of the future that will excite and convert potential followers. This vision may be developed by the leader, by the senior management team, or may emerge from a broad series of discussions. The important factor is that the leader completely buys into this vision, hook, line, and sinker. The transformational leader then has to constantly sell the vision, which he or she does by taking every opportunity, using whatever works to convince others to join the bandwagon. When implementing evidence-based practices in your organization, this clear vision and ultimate support and buy-in from leadership is critical. Another useful quality of the transformational leader is the belief that people will follow someone who inspires them and that the way to get things done is by injecting enthusiasm and energy. When initiating a culture shift, whether it's related to implementing EBP or not, it's helpful to have a leader that inspires workers and brings a sense of enthusiasm to the work. Specific to implementing EBP, it's critical that staff understands the reason for the change in practices and that they feel inspired and enthusiastic about joining the process. Next, the participative or democratic leader seeks to involve other people in the process. The assumption of this leadership style is that involvement in decision-making improves the understanding of the issues by those who must carry out the decisions and that people are more committed to actions where they have been involved in the relevant decision-making. So, in terms of implementing EBP, including subordinates, peers, partners, and stakeholders in the process increases buy-in and reduces resistance, thereby shortening the time and energy it takes to implement. I think it's important to be clear, however, that input from staff and stakeholders will likely focus on the process or the how of the implementation as opposed to the what or the specific evidence-based principles. For example, it would not work for a group of people to decide that they don't think that the agency should follow the risk principle that Nathan described earlier. This is a non-negotiable in terms of implementing evidence-based practices. But a participative or democratic leader would involve staff and stakeholders in decision-making related to how the risk principle will be applied in the agency. Servant leadership is next, and it's a natural model for working in the public sector. The servant leader serves others rather than others serving the leader. In this model, the leader is responsible for the followers and has a responsibility towards society and those who are disadvantaged. Certainly, this approach has application in the criminal justice field and to probation supervision in particular. Specific to EBP, however, this type of leadership is useful because it sees trusting relationships as a basic platform for collaboration and services, and it values creating commitment. My last slide, although I want to check in, I'm looking at the time, Sean and Nathan. I know we want to leave time for questions. Are you guys there?
Yes, Deena, I think you can just kind of quickly go through the 6 of these leaders. Yeah, just, I think that would be helpful to briefly summarize these styles.
Okay, I will do that. The concept of emotional leadership, I think, is interesting because it specifically looks at the effects of different styles on the emotions of those being led. So the authors of Primal Leadership describe these 6 styles of emotional leadership, noting that any leader can use any style, and a good mix that's customized to the situation is always considered to be the most effective approach. The visionary leader moves people toward a shared vision, telling them where to go but not how to get there, thus motivating them to struggle forward. They openly share information and give knowledge power to others. This style is best when a new overall direction is needed. The coaching leader connects wants to organizational goals, holding long conversations that reach beyond the workplace, helping people find strengths and weaknesses and tying these to career aspirations and actions. They're good at delegating challenging assignments, demonstrating faith that demands justification, and which leads to high levels of loyalty. So when we're training staff and managers on how to use evidence-based practices, this is a good approach because it builds long-term capabilities in folks. The affiliative leader creates people connections and thus harmony within the organization. It's a collaborative style which focuses on emotional needs over work needs. When it's done badly, it avoids emotionally distressing situations such as negative feedback, but done well, it's often used alongside visionary leadership and is good to be used when healing rifts or getting through stressful situations. The democratic leader, as previously mentioned, acts to value input and commitment via participation, listening to both the bad and the good news. Done badly, it looks like a lot of listening but very little effective action, but it's best used to gain buy-in and when simple inputs are needed, and it has a positive impact on your climate. The last 2 emotional leadership styles can actually hinder implementation if the leader is not careful, but there are parts of each style that can be useful. While it often has very negative effects on climate, which is typically because it's often done poorly, the pace-setting leader does bring some useful qualities to the effective EBP implementation. The pace-setting leader builds challenge and exciting goals for people, expecting excellence, and often exemplifies it themselves. They identify poor performers and demand more of them. If necessary, they'll roll up their sleeves and rescue the situation themselves. When changing a culture to one that is evidence-based, leaders must be ready to confront resistors and poor performers and to demand adherence to the chosen curriculum or model. Unfortunately, this type of leader tends to be low on guidance, expecting people to know what to do. They get short-term results, but over the long term, this style can lead to exhaustion and decline. It's best used for results when you have a motivated and competent team. The commanding leader soothes fears and gives clear directions by his or her own powerful stance, commanding and expecting full compliance. Agreement is not needed. They need emotional self-control and for success and can seem cold and distant. This approach is best in times of crisis when you need unquestioned rapid action and with problem employees who do not respond to other methods. Generally speaking, this type of leadership is helpful to EBP implementation only insofar as it communicates a clear direction to all staff about what's expected and the expectation on the part of the leader of full compliance. So clearly there are bits and pieces of each of the leadership styles that can be called upon to help promote an effective EBP implementation. Hopefully this gives you some ideas about things to consider if your agency is moving in the direction of evidence-based practices. Thanks.
Thank you, Deena. And at this time, I'd like to, before we get into the QA session, I'd like to quickly recap the main points of today's training. First, in discussing the 8 guiding principles of effective intervention, the EBPs that have been implemented in my co-panelists' respective jurisdictions, we have plenty of empirical evidence to conclude that this approach is effective in reducing costs for jurisdictions and the number of individuals who recidivate, while of course not threatening public safety, if not ensuring better public safety. This is very important with respect to probation, since it is at the, probation is at the front end of the criminal justice system, where effective interventions at that stage can impact other stages of the criminal justice system, namely prison and parole. Secondly, agencies and managers must be cognizant of the common challenges discussed by my co-panelists with implementing EBPs and, more importantly, sustaining them over the long term. Also, as discussed by Dr. Nagy and Ms. Corso, there are specific elements that are essential to successful implementation of EBPs, including effective leadership, sufficient planning and case management, a clear vision of the agency's objectives and goals, and buy-in from community stakeholders, which obviously can be possibly the most challenging. And speaking of leadership, we heard our panelists discuss a variety of characteristics, styles, and qualities that make a good leader. Essentially, managers and administrators must take many stances to promote sustainable change and effectiveness with regard to EBPs. And on that final note, I'd like to thank my co-panelists, Dr. Nagy and Ms. Corso, for their participation today. And before, again, we get into the Q&A, I'd just like to direct everyone's attention to one particular resource. If you're interested in learning more about EBPs and community corrections, you can find more information at the Crime and Justice Institute's websites provided on this slide. Specifically, this link will take you to the Institute's EBP integrated model, which may be familiar to some of you all. This model takes into consideration organizational development and collaboration in addition to the evidence-based principles as we discussed today. Thank you very much, and at this time I think, Sean, we can begin the QA session.
Okay, great. That was a really terrific presentation. Thank you, Dr. Nagy and Ms. Corso, and thank you, Mr. Lowe, for leading us through it. We've had several questions come in throughout the course of the webinar. I'm just going to start and read down the list in the order they came in. So, first one, is there a difference with regard to risk assessments between probationers and prison releasees and parolees? Sounds like there's some confusion from some of the people listening to the difference between these two populations.
Is that question for either one of us, or?
It's for either one, yep. Okay. I think it came in, Dr. Nagy, during your part of the presentation.
Okay. Well, there are two different populations, but the same kinds of factors help determine how risky an individual is. So both probation and parole assessments have very common factors. For example, a item that's almost on any risk assessment is the age in which the person had their first arrest or conviction. The younger a person is, the more risky they tend to be. And I'm talking about risk in terms of the probability of reoffending. That's relevant whether you're a pretrial defendant, a probationer, or a parolee. So you'll see common factors, but each assessment should be validated for the particular population that you're dealing with. So an assessment that's used for probation before it's used for parolees should be validated for parolees in that specific area.
Got it.
I think that's...
Okay. Let me see. Dr. Nagy, this question came in during your part of the webinar, so I'm going to direct it at you. But the person said, I'm not sure if you were speaking about cognitive behavioral approaches, but they kind of thought that you were. And they wondered if there's been any discussion regarding to the Thinking for a Change program. Your thoughts on that?
Okay. Let me give a little bit of clarification. Our department made many changes in our probation operations as well as our programs. But for the most part, the outcomes that I talked about, those outcomes had the same programs available pre and post. So the outcomes I'm measuring have to do with probation supervision, again, that alliance-based approach, whether or not they focus on criminogenic needs, whether or not they worked as a team with a treatment provider and that sort of thing. and whether or not in their own sessions focused on the individual's thinking. The cognitive comes in terms of the quality and design of treatment programs that are there to address substance abuse, for example. Each of those programs should have a cognitive curriculum, and then you would measure that to see if that curriculum actually contributes to the success of that program. So it's kind of two different issues, but as I was speaking, I was talking about the changes that we made in the probation system, not necessarily the changes that we had in particular programs. Is that clear, or is that helpful?
I think so.
Okay.
Yes, I do. Okay, I've got a question here for Ms. Corso. This person wants to know, what type of training would you suggest to build alliance-based versus fear-based probation practices? Or are there such trainings?
Yeah, it's a great skill. It takes a lot of time to hone this skill, I think, to get away from trying to get people to do things because something bad will happen to them if they don't, versus really building a relationship and understanding the world from their perspective and helping them to want to make changes based on what's going to benefit them and the people that are important to them in the long run. This is a big piece of the FFPS training that our probation staff received. It's not something that comes easily to probation staff to kind of change the way that you look at families from dysfunctional and problem-centered to being strength-based and seeing the family as holding the key to solving their problems. So it takes not only just sort of learning about it, but I think a lot of guided practice on the part of the probation officer. In FFPS, there's observed sessions where the supervisor or consultant actually watches the probation officer and gives feedback. The way that staff talk about cases, you can often coach staff to talk about to pay attention to the way that they talk about the youth or the families that they're serving. So if they're using words like manipulative and gamey, they're probably not being real alliance-based. And so I think it's a skill that takes a lot of time to really get good at. But for our staff, that training really has come through the implementation of the FFPS model for case management.
All right, great. For either of you, what measures were put in place to assist officers in being able to get consumers quickly into the appropriate programs that would fit their needs? The problem that we usually have is that revocations are quicker and easier.
Well, this is Geraldine. I worked a great deal with our judges because our judges at first said, you're going to create issues here. We're just going to have these long waiting lists. And from my point of view, it is better to put someone on a waiting list than to put them in prison and try to have at least cognitive programs or treatment readiness programs and that sort of thing. And in any case, that isn't actually what happened. We did get additional resources, and I think some of the reason why we got additional resources is because we could then, through our changes, identify those people who actually need treatment and have that data available to ask for resources. So this had to do a lot with our judiciary and what they were willing to do and their support. But the second thing I wanted to say is, often it's not how much resources you have available, but how you use them. For example, when we first started here in 2005, we had people contact treatment providers themselves for outpatient treatment, and guess who got in quickly? The low-risk folks. When we changed that process, identifying high-risk folks and requiring them to get in most quickly, then what we find is those people on our waiting list generally did pretty well because they were low risk, and we work with our judges not to put them in treatment at all. But secondly, if they had been in treatment for a while, if they'd been on a waiting list and nothing had happened, and they're doing well, we amended their conditions. And so we found out it was leveraging our resources more than anything, and the assessment allowed us to do that.
I think in our experience is very similar, just making sure that you're putting the right the right people into the right slots, and lots of collaboration and talking with your providers to identify gaps and make sure that we're filling those gaps.
Great. Thank you both. Okay, I've got a lot of questions coming in about risk needs assessments. One person wants to know the types of factors that are included in a risk needs assessment. Another wants to know if there are specific assessments for parolees, and if there's specific assessments for probationers. I mean, are there different instruments? One of you wants to speak to
I
that?
know that Ed Latessa is working on, this is Geraldine, working on assessment package from pretrial through probation to parole and then exit from prison. And so he's developed these assessments for these various points in time. And I just got that on my desk yesterday looking through it. I was familiar with the probation one but not the others. So they are available for the different populations.
Okay.
Yeah, and if I could speak to that too, Sean. I know, and as I was reading some of these questions that were related to risk and needs assessment for various populations, and I believe it's through the Justice Center, the website in which there's a specific, I guess, guiding tool which you can find and locate a variety of different assessments that may be appropriate and right for your agency for a specific subject population. And if whomever wants to contact me afterwards, I'll be more than happy to provide them with that link for more information. But secondly, I think what's important, and I know Dr. Nagy just has spoke about this, about making sure assessments are conducted at various points in the supervision or the correction system process. And I think that's very important, is that maybe you initially an individual begins at the probation supervision level, but there's assessment, validated risk needs assessment is used there, and there's a particular score or risk assessment level the individual is supervised on, where the individual maybe just have difficulty and end up getting into the prison system, and then at that point there's going to be an additional assessment. And then prior to that individual leaving prison and particularly onto parole supervision, specifically, there'll be another need to assess the individual's risk and needs. And so the point being is that I think it's a continuous process of being able to assess the individual at a given point in time, and because as everyone knows, behavioral change takes it's a process. It's a marathon, not a sprint per se, and it takes time, particularly for more of the higher risk folks in which EBPs are concentrated upon, or at least that's what the research is telling us, is to concentrate more intervention efforts to those higher risk folks. So I guess the point being is that assessment is needed at a variety of different points of time to assess it. So it's just not a one-time process. It's a continuous process of learning about the individual and how to best help and address the individual's needs.
All right. Thanks. Next question I'm going to direct to Dr. Nagy. This person wants to know if the implementation of evidence-based practices has had an impact on technical violations. Have you seen those?
Yes. We've had we sustained a 50% reduction in technical violations compared to 2005 for 4 years now. Mm-hmm. And I think there's a number of things that contribute to that. I think the greatest thing is the change in the approach and process of actual day-to-day supervision. So, again, you have that alliance-based supervision. You have folks working as a team with the treatment provider. You have folks doing motivational interviewing to get people to engage in treatment and grow in their commitment to treatment. So there is a lot of things going on with that. But at the same time, there's other factors involved. You know, we've educated our judges. They've received training in substance abuse, and they all know now that substance abuse is going to have some, there's going to be people using again, and it's a relapse. And so with that education, I think they are more likely to give a person a chance or two after they've had a positive UA. So there are a number of factors involved, and I think part of it is just there's more transparency, and then there also is a measurement of results, so people know it matters.
Great. Ms. Corso, question for you. This is from a person who works for a community-based organization in California, and they want to know if your agency works with community-based organizations, and also if you also collaborate with other agencies, and if your community supervisors play a role.
Yes, to everything. I think we have numerous collaborations with our community, with our partners, with our treatment provider community, with our faith community, with our just pretty much everything you can think of. Yes, yes, yes to everything. We really rely on those mechanisms. It's truly our belief that we don't want folks to have to rely on the system, the criminal justice system, the juvenile justice system to get their needs met. And so it's a strong value of ours to connect folks with people in the community that can help them get those needs met, so that they're not having to cycle through our doors to be able to get their basic needs attended to.
Okay, great.
I'm not sure if I answered that fully, but I think yes to all of those different groups that you asked if we had partnerships with.
Great, I think you did. Okay, we're nearing 3:30. I think just concludes one final question. I've had a few questions about evidence-based practices and cultural sensitivities. So the question is, do evidence-based practices take into account cultural sensitivities, cultural differences?
I think that's a huge piece of the responsivity literature and research about adapting your services to meet the specific needs of the offender or the client that you're working with. In FFPS, it's called matching, which is basically teaching officers that it's their job to match to the family and not to expect the family to match to the person that's supervising the youth and helping the family. So that's a gigantic piece of really being able to build, again, that alliance with the family and making sure that we're providing culturally appropriate resources and services to individuals.
All right. Fantastic. I think that does it. But thank you both, Dr. Nagy and Ms. Corso, so much for presenting today. Thank you, Mr. Lowe, for kind of coordinating this and walking us through the presentations. I think it was a fantastic webinar.
Thank you.
Yep. So this concludes the Evidence-Based Practices of Community Supervision Part 1 webinar. Again, Part 2 will be held at some point in December, likely beginning to mid-December. Once we have a date nailed down, I'll make sure that everybody that registered for this webinar receives the invite to Part 2. As for today's webinar, after you exit the webinar, a brief survey will appear on the screen. By answering the questions in the survey, you will be helping the Resource Center improve on the services we offer. We'd greatly appreciate it if you would take just a few minutes to complete this survey. Once again, thanks to our presenters, Dr. Nagy, Ms. Corso, and Mr. Lowe. We will email a link to the recording of this presentation as well as a link to a PDF of the PowerPoint slides used in the presentation early next week. These links will also be made available on the National Reentry Resource Center's website, which you can visit at www.nationalreentryresourcecenter.org. Thanks again for participating today.